Hi, I'm Bonnie Nasar, and we're here today to talk about mast cell disorders, optimizing dietary management in MCAS and mastocytosis. So, a little bit about me. I have a private practice, Nasar Nutrition, where I deal with mast cell disease, Ehlers-Danlos syndrome, POTS, gastroparesis, chronic pain, autoimmune diseases, and I am a member of the Academy of Nutrition and Dietetics. I'm a volunteer and I'm a lecturer for the Mast Cell Disease Society. Um, I'm also a volunteer mentor, and I provide diet guidance for new moms of kids with mast cell diseases. I am a member of the Diet and Nutrition Working Group through the EDS Society International Consortium. I am co-author of the first peer-reviewed journal article on mast cell disease and nutrition. I'm also a fellow Zebra. I have HEDS and POTS, and I am mom of 4 kids. 2 of them have cutaneous mastocytosis. So because of them, that's how I got into this field. And that's kind of how I started to learn about mast cell disease and nutrition. They are now 20 and 22. So it's been a really long time living with 2 patients and learning all about this condition. And I'm happy to share my knowledge with you today. Our learning objectives for today, first and foremost, are to understand mast cell diseases and mast cell activation syndrome, which is under the umbrella of a mast cell disease. I want you to gain clarity on the importance of individualizing dietary plans for the management of mast cell diseases. We're going to discuss the pros and the cons of the SIGI histamine diet list. I also want you to know what to do nutritionally when a person is first diagnosed with a mast cell disease. Where do you start? We're also going to get into how to proceed if a person is already following a low histamine diet. I think it's also important for everyone to learn about over-restricting your diet and how and why this can negatively impact mast cell disease symptoms. We'll also talk a little bit about the supplements that might be helpful for patients with mast cell diseases, and appreciate the importance of having a professional who is well-versed in mast cell diseases guiding you to manage these very complex symptoms and diseases. So, mast cell diseases are a group of conditions that really either can be an abnormal accumulation of mast cell disease within the body or an abnormal activation of mast cell diseases. And they can cause a whole host of symptoms, which are allergic-like and are also immune responses. So what these mast cells are doing when you have a mast cell disease, they're releasing mediators. One of them, the most common that people hear about, is histamine. And this can cause tons of different symptoms. But it's also important to know that histamine is not the only mediator that gets released. There are hundreds, if not thousands, of others. Some we know of, some we don't even know of. And each one can cause different types of symptoms. So there are several types of mast cell diseases. We're not going to get into all the different types, but the most common are mastocytosis and mast cell activation syndrome. So mastocytosis is systemic or cutaneous, meaning system-wide, or cutaneous just only in the skin. And it's marked by an excessive number of mast cells, so more mast cells than a person should have, that are made in the bone marrow, and they accumulate in places like the skin or internal organs, and everyone can be different as far as where that accumulation can be. MCAS, mast cell activation syndrome, is a normal amount of mast cells, but they behave abnormally and they release mediators and trigger symptoms. So at the end of the day, you can have the same symptoms from both, but it's a slightly different mechanism as to what's going on in the body. Mast cell disease symptoms can typically include flushing, abdominal pain, diarrhea, headaches, cardiovascular issues, and a whole host of other things. There are diagnostic criteria that have been published, and it's important to follow those diagnostic criteria for proper diagnosis. Treatment typically will focus on managing your symptoms with antihistamines, mast cell stabilizers, and there's also some other medications that can be utilized, which we're not going to get into here. If you want more information on mast cell disease diagnostic criteria, you can check out this paper by Dr. Valent, which talks about the classifications. So there was one study on EDS patients and mast cell diseases, and what they found was that 24% of EDS patients had an MCAS diagnosis. 28% of HATS patients, that's hereditary alpha-tryptosemia, which is another type of mast cell disease, had joint hypermobility, meaning they had symptoms, they had mast cell disease and symptoms of joint hypermobility. 66% of patients with POTS and EDS had symptoms that were suggestive of a mast cell disorder. And patients with signs of a connective tissue disorder, so again, that includes more than EDS, had a higher density of kinase positive mast cells within their skin, which means that it kind of causes inflammation and stuff like that. And there was a significant increase in the prevalence of idiopathic urticaria in EDS patients compared to the general population. So issues with histamine, right? So this is all really interesting and relevant to the EDS patient community. So managing MCAS often will involve dietary adjustments, but it's essential to approach this carefully. A low histamine diet may be beneficial because histamine-rich foods might cause symptoms, right? So some of the common high histamine foods, which we'll get into in a little bit, include aged cheeses, alcohol, fermented products, and a whole host of others. Dietary changes should be individualized. It should not be on a one-page handout that someone gave you and you just follow it. And really, any other specialized diet that you are going to attempt should have good evidence of necessity, meaning there's a good reason or good evidence in your symptoms to be trialing this diet. A symptom diary can help to identify your triggers by tracking what you ate and any subsequent reactions. But we got to talk about a few things. So not everyone will react to a high histamine food list, okay? Not everyone will react to the same high histamine foods. No two patients will have the exact same triggers. And believe it or not everyone will have food triggers with mast cell disease. So we have to take all of these things into consideration. I do always like to give you the example of my two children. So obviously they have the same parents, they're genetically related, they have the same disease, and they even to the point where their solitary mastocytomas are actually in the same location, okay? So that's how similar looking their mast cell disease is. But they do not share all the same triggers. They have different food triggers. They have different medication triggers. They have different environmental triggers. So really, we do have to look at the individual, and we can never say what works for one patient is going to work for another patient. It's unfortunate that we don't have a one-page handout that we can just say, hey, avoid this list and you're going to be great. I wish we did, but there is no magic list. So just to give you a little perspective, this is from Jennings. This is a paper that the Mast Cell Disease Society put out, and they gave a questionnaire to patients with mast cell diseases, and they asked them, what foods do you react to the most? And of all the people that they asked, we had tomatoes as like the number one in the vegetable group. Now, tomatoes, those are high in histamine. Okay, in the fruit group, citrus, yeah, that's high in histamine. But the dairy group, milk, right? Milk, not really high in histamine. It's really the aged cheeses that are high. So obviously, it's not always a histamine issue because histamine is only one of the mediators that are released or one of the mediators that can bother mast cells. So we do have to take into account somewhat what are the most common foods that patients will react to, but then we also have to ask, well, what do you react to? So if you see this graph and you're like, oh, but I eat red meat all the time and I have zero problems with it, right? So, okay, then maybe you don't need to get rid of red meat, right? So we do need to take everything that we see with a grain of salt. So the first thing I always say is to utilize a food and symptom diary, and I will sound like a broken record with this. You can use an app, a fancy app, a simple app. You can use a pen and paper, whatever works for you. And you want to track the foods you eat, the symptoms you have and what time you have them and how severe they are, and you want to play food detective. Now, for some people, they can do this on their own. For some people, it might be too difficult. If it feels overwhelming, that's okay. You should consult with a nutrition professional that has expertise in mast cell diseases that can kind of help you play food detective. So let's talk about the SIGGI list, which is the low histamine diet. So this is the elimination of foods that are high in naturally occurring histamine. Histamine is an amino acid that's naturally found in foods. And also some foods that are thought to be histamine liberators, meaning they liberate histamine within foods. The SIGGI list, they claim to categorize foods based on their histamine content, but we'll see in a little bit it lacks scientific validation. The elimination of all foods on this list is unnecessary, and it leads to unnecessary dietary restrictions. The histamine content of food is not the only trigger for many people, and it may not even be a trigger at all for some. So it is very important to rely on evidence-based resources and consult with a healthcare professional before making any very significant dietary changes. So here, this is from the SIGGI list, their website. So it's a Swiss interest group, histamine intolerance. Now that's an important thing to know, histamine intolerance. Histamine intolerance is actually a different diagnosis than a mast cell disease. They are not the same. These people who are diagnosed with histamine intolerance are only intolerant to histamine. Okay, so if you look at the references, which I circled here, you'll see it says this is really based on members and readers, information from them, leaflets from doctors, clinics, and hospitals, experts from patient organizations, bloggers, and forum threads. Like, since when is that a reference? I don't know. Scientific publications. That's nice. What are the scientific publications? Textbooks and cookbooks. It's not great information there, those references. So we do have to take it with a grain of salt. One thing you'll see on the right side of the slide, though, is that they do actually tell us this is not meant to be a long-term diet. You are supposed to put foods back, reintroduce those foods after 4 to 6 weeks to see what you can tolerate on this diet. So to their credit, they do actually tell patients this is not a long-term diet. So what is it good for, the SIGGI list? It's good for a place to start. So you can review the list. You can circle the foods on it that you believe are a problem for you, okay? But also realize that, eliminating foods that might be an issue is not the end of it, okay? So you eliminate foods, any symptom changes. After that elimination period, you reintroduce foods and you note if that symptom came back or not. So if the symptom returns, you can consider the amount eaten or the need for, eliminating that food from your diet, or maybe reducing the amount that you eat to see if you can tolerate small amounts of it. And if the symptoms don't return, you can consider that food safe to eat. So we have to remember reintroduction is actually part of the elimination diet. So there are a few disclaimers with this. If reactions to any of your foods are anaphylaxis, you must consult with a physician before attempting to make any changes. The same goes for, any type of elimination diet, okay? Not just for the SIGI list or low histamine, but any elimination diet. The information on this slide, it is not a substitute for medical nutrition therapy. It's not a substitute for medical care. And again, in the interest of time, today's lecture is not providing you with like a step-by-step. It's really just an overview of the elimination and reintroduction practices. So starting points for someone who's recently diagnosed. If you've been recently diagnosed with MCAS and you have not made any dietary changes, you want to start with logging your food and your symptoms in a diary. This will give you good information to give you a list of what maybe you could eliminate from your diet to see if it changes things for you. If it's difficult, you can consult with a professional who has expertise in mast cell diseases. Now, for a person who started a low histamine diet and is unsure if it's helping, again, revisit your approach. Start a food and symptom log. Over-restriction of foods that are high in histamine can lead to malnutrition and deficiencies, and that can overall worsen your health and actually cause mast cells to get angrier and release their mediators more often. So you can consult with a registered dietitian or a registered nutritionist experienced in mast cell diseases to help you balance your nutrient intake again. This is not a black and white issue. It is shades of gray. Sometimes that can be overwhelming. What are the risks of overly restricting your diet? A lot. Disordered eating, malnutrition, vitamin and mineral deficiencies, and just an overall decline in your health. So you do want a varied and balanced diet as much as you can while still avoiding or minimizing exposure to any triggers that you have. When we manage mast cell disease nutritionally, you need to have a combination, dietary modification and sometimes supplementation. So there are supplements that could potentially suppress mast cell activation. Those include probiotics, flavonoids, curcumin, which is the active ingredient in turmeric, vitamin D if you're low, zinc if you're low, vitamin C if that's tolerated. Diamine oxidase can help people with histamine intolerance. Cinnamon extract has been shown to inhibit mast cell activation. Azuki bean extract, L-theanine, which is found in green tea, can help. PEA, but again, you have to be careful with that. If you do want to make sure it's that you're deficient in it before, or get a blood level before. Because some people actually have high PEA due to another reason. Alpha lipoic acid can be helpful, and sodium alginate can help with reflux. So you always want to talk to your practitioner before adding any supplement or herb. Natural and organic does not necessarily mean safe. You have to be aware of excipients, preservatives, etc. Sometimes people need a compounding pharmacy to make their medications or supplements to avoid ingredients that offend them. You want to add one at a time and record reactions. And it will be a very individual approach. You must check with a physician or a pharmacist to make sure there's no drug-nutrient interaction with the supplement. And let's go over a case summary. So this was a 25-year-old female who was diagnosed with MCAS. She found the SIGI list online. The doctor told her to get on a low histamine diet. She eliminated all the foods on that list, every single one of them, even though they didn't bother her. She did not feel good after several weeks of being on this diet. She got bored with her meals. She kind of stopped eating the amount that she needed in order to sustain her health every day. She had worsening of symptoms, particularly fatigue. And when we went over her dietary recall, it was obvious to me she was not eating enough food to sustain her. And that was where the fatigue was coming from. So together, we made a list of foods she wanted to include that she missed desperately, and we added them back in a very controlled manner. We also started her on a quercetin supplement just based on her symptoms. And after about 4 weeks, her symptom score improved and her fatigue was basically gone. So it was really nice to see that, but also sad for someone like me as a practitioner to see that, unknowingly another practitioner had given her advice to get on a low histamine diet. She took it obviously to heart and eliminated everything when she did not need to. Thank you so much for listening.